I would like to just mention how common is cervical cancer. If you look at the world statistics, cervical cancer is the 4th common cancer in females. On the other hand, in Malaysia, it is the 3rd commonest cancer in females, and this is based on the statistics from year 2020. Now, what is more important is you should know what are the risk factors. The first risk factor is that after sex, all women are exposed to the HPV virus, and therefore they already have an increased risk to cervical cancer. The factors related to sex will include 1. Early onset of sex. That means the younger you start your sexual activity, the higher will be your risk. It's also been found that women who have multiple sexual partners are at a higher risk. And lastly, but not least important, the partner, the woman's partner also. If he has multiple sexual partners, then the woman is also at higher risk. So these are the main high risk factors. And of course, any woman who has picked up an HPV infection, then that particular woman, if she has got infected with the high risk types, then she will be at a higher risk. So these are the main risk factors for cervical cancer in women. So cervical cancer is basically cancer of the cervix. Now, the cervix is the structure at the lower part of the uterus. So that is the cervix. So sometimes women do get cancer of that area. That is cervical cancer. Now, in simple terms, a normal cell from the cervix can change into what we call a pre-cancerous cell. And from the pre-cancerous cell, this can progress into cancer. So basically, that is how the cancer cell forms from a normal cancer cell. The common cause of cancer is already confirmed that it is due to a virus called HPV. HPV stands for the human papillomavirus. And in cancer cases of the cervix, 99.7% of the cause is due to this virus, HPV. If you look at the women who get cervical cancer, I'll put it this way, anyone can get cervical cancer. However, it occurs more in the women of the older age group. What I mean is, maybe age 40 to 60 years of age, that would be the maximum incidence of cervical cancer. And I'd just like to inform women that the oldest woman who had been confirmed to have cervical cancer in the world, she was 78 years old. Therefore, it is our common practice to screen for cervical cancer in any woman as long as they agree to be screened, no matter what her age. First of all, I would like to say that most of the women do not have any complaints, right? And therefore, the importance of screening. The most common would be irregular vaginal bleeding, and in the older women, especially post-menopausal bleeding. So these women have to be very careful. The second common complaint is bleeding after intercourse. That happens. We call this postcoital bleeding, and sometimes patients have foul-smelling vaginal discharge. Now, if a woman has some vaginal discharge and it is blood-stained, then you have to be careful too, because that could also be one of the complaints of cervical cancer. So these are basically the common symptoms or complaints. In my opinion, of course, yes. Now, there are two ways primarily to prevent cervical cancer. One, vaccinate yourself with the HPV vaccine. Now, this is easily available at most clinics and gynecological clinics. And the latest one we are using nowadays is what we call the 9-valent vaccine, or Gardasil 9. Now, the second way is, as I explained to you earlier, that the normal cell becomes pre-cancer and then becomes cancer. If we catch the disease at the pre-cancer stage and we treat it effectively, that will prevent cancer. So these are the two ways to prevent cervical cancer. Once you have cervical cancer, there are three modalities of treatment, we call that. Three ways to treat. One is surgery. Surgery is mainly reserved for early cancers because when it's too late and it spreads, it's not easy to do a complete removal of the cancer tissue and the surrounding tissue. Now, patients also can be treated by radiotherapy, that is using what we call radiation therapy, which can be effective too. And the third modality would be to use drugs. So this is what we call chemotherapy. So these are the three main ways to treat cervical cancer.